Lesley is a haemoglobinopathy nurse and is actually Sienna's specialist sickle cell nurse as well. Thank you for joining me today, Lesley. It's so nice to have you here. Lesley is an absolute godsend to our family. Any issues we have or any questions I have, I know that I can contact Lesley and she's always there for us. And I just want, to let you know that we are so happy that we have you and we really appreciate everything you do for us and also the community. So please tell us a little bit about yourself, Lesley, and how you became a haemoglobinopathy nurse.
Thank you, Hayley. So I was an adult nurse originally when I did my training back in late 80s, I want to say. But then I very quickly decided that I wanted to be a children's nurse. So I went on and did additional training and became a children's nurse. I've worked in quite a few different areas of paediatrics, acute paediatrics, but I spent a lot of time working in the community where I looked after children with a very broad range of conditions. And it was really working in that environment that sort of drew my attention to children with hematological disorders, and also the fact that there was a group of children, young people that didn't really have the support of a specialist nurse like other children with chronic illnesses do. And I was really interested in hematology, and when this job was advertised, I just thought, wow, I really want to apply for that, because I love looking after children and families where they have a chronic condition, because you build up that relationship and you really get the opportunity to not only look after the young person but also the family, and it's also about empowering the family and the young person and educating. So it's a really broad role. And so I started specialising in haemoglobinopathies about 3 years ago now. So yeah, I really love the job, and I love the families that I look after. It's brilliant.
Yeah, and your position is funded by the Roald Dahl charity, isn't it?
Yeah, so the Roald Dahl Marvellous Children's Charity are an excellent charity in the way that they use what we call a pump priming model. So they seek to support specialist nursing posts where there has been sort of lack of funding through the NHS, and what they will do is they will fund the post for the first 2 years with an agreement with the trust that they will then fund that post for further 3 years beyond that. So initially there tends to be a 5-year contract, but I think they've now funded about 80 different posts around the UK, and none of them have been sort of withdrawn after the 5 years. They've all continued to grow and develop. So
wow, that's incredible. And it is an absolutely marvelous, no pun intended, but a marvelous charity. So
I think the good thing about them as well is they not only fund you for the 2 years, they continue to support you beyond that. Particularly, there's lots of additional sort of aspects of the charity work that they fund, but also they really like to invest in the education of the nurses to really develop them and to develop the roles and the services that they're working with.
Yeah, and before Lesley, before you started, we had no nurse. So we had no other contact with the hospital other than with Sienna's consultant. We had a haematology nurse that covered both pediatrics and adult care when Sienna was first born. But I think that position, there was nobody for almost 10 years. And so, yeah, this is why we appreciate you so much, because we went so long with just having nobody that we could contact. And I think especially for parents, when they're unsure or they want to ask a question, just having somebody like you takes so much pressure off of parents, because they just feel like you are our safety net almost. We know that we can always get hold of you, and it just makes life so much easier for us.
I think that's true, because it's having that point of contact, isn't it? Because as much as the consultants are really there for you to look after your child, they haven't got the capacity to pick up the phone and deal with those every sort of day or questions that you might think, oh, I don't want to ask them, because it's
and they're not always accessible, because consultants, their schedules are so full on, and that sometimes if you've got an urgent question, there's no way, unless you by chance can get hold of them that day, sometimes it's a good 3 or 4 days before, you know, their secretary can get hold of them, get an answer and get back to you. So it's just nice. And because you are a specialist nurse, you really know your stuff. You can really empathize with people's situations. Whereas if we do have something and we take Sienna to the GP, for example, then they are not knowledgeable enough about sickle cell to make a decision. They still need to contact a consultant or a specialist nurse to get some help with any decisions that they're making. But on that note,
although it's the most common inherited condition in the UK, in some areas it's still, the prevalence is still quite low. So some GPs or hospital staff, nurses, etc., may not have looked after a person with sickle cell disease before.
Yeah, definitely. And I think GPs do get, you know, a lot of black about stuff, but it's impossible to know everything about everything. And I appreciate if we do see a doctor that is not sure, then they'll say, oh, do you know what, I need to ask somebody who knows about these things. I would much rather that than somebody kind of have a guess. So yeah, when you have a specialist supporting you, it's very, very nice.
Reassuring.
Yeah, reassuring, definitely. So you're obviously a qualified nurse. Can you tell us a little bit more about sickle cell for those who don't know anything about it, please?
So sickle cell disease is an inherited condition, and it affects the red blood cells, particularly the haemoglobin in your red blood cells. And how it manifests is red blood cells typically are like a donut shape, quite flexible and soft, and will spring back. They will squeeze together when they're going through the blood vessels, but they will spring back to their normal shape. For someone that has sickle cell disease, there's a genetic error in the part of the hemoglobin, and it means that over time, instead of it being round and donut shaped and spongy, it gradually becomes sickle shaped, which is where the term comes from. So sickle is like a crescent shape, and sickle is a farming tool, isn't it? Yeah, so the red blood cells become like a sickle or a crescent shaped, and they become rigid, less flexible, less affinity to carry oxygen, because one of the functions of hemoglobin is to carry oxygen around the body to all the different organs and the cells. And because it changes shape, becomes more rigid, it has less affinity for carrying oxygen, but also it has the possibility of getting trapped or stuck in the red blood vessels because they all clump together. And when that happens, they block the small blood vessels, the capillaries, and they prevent oxygen from getting to that part of the body. And that's what causes the pain. So the main things for someone with sickle cell disease are risk of painful crises, which can be life-threatening, depending on which organs they're affecting, and also risk of infection. And that is because there's an organ in the body called the spleen that filters out bacteria, but it also affects the ability to prevent infection. So therefore, that's why, infection is a big risk for people.
Yeah. So Sienna actually always used to have a crisis in her spleen. And so over a period of time, her spleen never went back to its normal size and stayed enlarged for a very long time.
Yeah.
And I'm not sure, were you Sienna's nurse when she had her spleen removed?
No, she'd already had that done.
She'd already had her. See, you've got great memories here, as you've got so many patients. So she had to have her spleen removed and was pretty poorly after. But like you said, now people that do have their spleen removed are even more susceptible to getting infections, aren't they? Because they don't have that filtration system.
What happens with the spleen is the red blood cells become trapped in there, and the blood flow doesn't work effectively. Mm-hmm. So it takes the red blood away from the circulation, so it affects your hemoglobin, can go down quite significantly. So
yeah.
If you've had, that's what we call sequestration, and if that's happened on several occasions, then they may well remove the spleen because it's too dangerous.
I think Sienna's spleen weighed 900 grams when they removed it, and they couldn't. I think it was about 11 centimeters enlarged, and she was only 7 or 8. So it was significantly bigger than every time she sat down or she was lying down, she could feel it compressing everything.
Yeah.
And yeah, it was so much easier when she had it taken out, although she had a really long recovery time. Yeah, it was so much better when she had it removed. There was no more backache and all that kind of stuff. So Lesley, why does sickle cell affect people differently?
So there are what we call different genotypes. So like I said, it's an inherited condition. So if you've got two parents where they're carriers of the sickle gene and the child inherits that from both parents, they have what we call SS, so they've inherited sickle from both parents. But you may have a parent where one has the sickle gene and the other parent has an abnormal hemoglobin, say C hemoglobin, and if they were inherited in that way, the child would have SC, which so that's what we call a different genotype. Generally speaking, some genotypes have a less severe course than others, but it doesn't always follow. And I don't think it's actually fully understood why some people have more severe complications than someone else, even if they have the same genotype, for instance.
Yeah, definitely.
It's not fully understood why that happens, but I mean, there's a lot of research into gene therapy and things like that, so it may be something that's identified in the future that we can say that's why you have a more severe form than somebody else.
Yeah, definitely. I was speaking to somebody earlier about the gene therapy, and we are all so hopeful that it will be something that is available to everybody. What advice would you? No, go on. It's fine.
It is still in the early stages. There have been they have carried out gene therapy in young adults in America, but they're still learning about the sort of the long-term effects of that at the minute.
Yeah, and how long that person can stay sickle cell free.
And like with any new procedure, these things are always really costly. So generally, it would be reserved for people that have more severe.
Yeah, definitely. What can people do to help manage symptoms at home, and when should people go to the hospital?
So symptoms as in
pain, pain or fatigue or
stuff. So like I've said, some people have more painful episodes than others, and it's not fully understood. But what can be quite helpful is to try and identify what triggers, because generally speaking, there are certain things that will trigger a sickle cell crisis, and they tend to be things like dehydration, which is because when you're dehydrated, your blood is a lot thicker, you've got less water. Now, if that is the case, it means that the sickle cells are more likely to clump together and cause a blockage in the small vessels. So dehydration can be something that triggers it, along with heat, and that's because when we're hot, our the heat causes the dehydration. That's kind of like fits with that. And the other extreme temperatures, like really, some people are affected by extreme cold or cold weather, and that's when you're cold, your blood vessels constrict, so then you're more likely to have a blockage with the sickle cells. And then there's other things like infection. Infection typically affects your hemoglobin, can drop it, and it can lead to sickling as well. They tend to be the general things that cause sickle cell crisis, but not everybody is the same, and some people are more sensitive than others. Some young children only have to drop a couple of degrees and all of a sudden they've got pain in their legs or their arms or whatever. Other people seem to be able to withstand it more. So I suppose what I'm saying is it's probably good to try and make note of what is affecting your child,
And I think that's something that I've learned over time is when children are very, very young, it's almost like a guessing game. But as they get older, you learn more about your child. So even with the sense of, I can look at Sienna and know how much pain she's in, or if a crisis is going to start, or if she's done too much or anything like that. And obviously telltale sign most occasions is the yellowing of the eyes. However, Sienna's kind of learned now that she can downplay her pain, or she tries to, but I can see that she's in pain and things like that. So I do say to parents, the older the child gets, it's a lot easier to manage things, because you learn so much along the journey with what specific things trigger them. So
yeah,
for instance, we were talking about swimming, and some people just completely cut swimming out because they know that that's a trigger. Whereas we've kind of developed this routine to allow Sienna to go swimming, but we have like a wetsuit for her. We make sure that as soon as she's out of the pool, she strips off and she wraps herself and stays like that for like a good kind of 10 or 15 minutes. Or she goes, if it's possible, to just go straight into a warm shower where she just stays there, and then she wraps up and stays dry and warm as well. But these things have taken some time for us to kind of get to the point where we can predict almost, or have come up with these routines to help her and prevent a crisis from occurring, but still allowing her to do a few things safely.
And I think that is the key. It's about prevention, isn't it? So, yeah. I mean, general advice we always say to all families, and things that we sort of start talking about from quite a young age, is always make sure that you're hydrated. So encourage, you know, your child, a young person, to drink a lot of water. And I guess if you instill those habits at a young age, it continues on, doesn't it, as they get older?
Yeah, you're so right, because Sienna has always been so used to drinking water, it's very rare that she will even drink anything else. But also her body she feels thirsty if she doesn't drink enough water. Yeah. Even if she's had 2.5 liters, she naturally always has a water bottle with her. She naturally now just constantly throughout the day will just keep drinking water, because she doesn't know any different. So I think her body is just used to constantly being hydrated. That is, it's very rare that you see Sienna and she hasn't got a water bottle on her.
And that's what lots of our patients are like that. So I would say, prevention. So drinking lots of water, wearing the appropriate clothing, you know, when it's cold, particularly at school, if they're going to have to do outdoor activities, making sure that they can wear leggings or, you know, flannel things in the winter. So prevention, like you say, swimming, it's, you know, what we really want is for children, young people to enjoy life like anyone else, but being aware that there are certain things that will trigger a crisis. So swimming, it is possible, but maybe you have to wear, like you say, a dry suit or a wetsuit. And if it's like swimming lessons or at school, is there some way that the temperature of the pool can be heated up, you know, for those particular lessons? And then, like you say, getting out and getting dried off, not hanging around in wet swimming costumes. But getting dried off and dressed quickly to prevent yourself from cooling down, really. Because obviously once you're in the pool, you're active, aren't you, moving around.
When we're on holiday, we do have like a good routine as well, where Sienna's not really allowed in the pool before 12 o'clock, because by that time it's heated up a little bit more. And it's also the atmosphere, because it's all well and good being in lukewarm water, but if you get out and it's freezing, that as well causes that cooling of the skin and stuff. And then we do say to her, like, if she's just playing in the water, then it's not strenuous, it's fine. But if she's actually swimming, we'll give her like a 30-minute interval. Then she has to come out, take a break, have some water, rest, stay dry, and then she can go back in, you know, an hour later or whatever. Because one thing is with Sienna is exercise is one of her triggers. Anything that's too strenuous for her, she'll either go into a crisis or be very fatigued and a bit achy for a few days. So like I said, it's all about learning the journey with your child.
Definitely. Picking up on what affects them. And actually that was something I didn't mention today about the anemia. So one of the other things of sickle cell disease, because the haemoglobin is to do with the oxygen carrying, most people with sickle cell disease have a degree of anemia. So which, like you said, affects your stamina and your ability to do exercise. And like, you know, we wouldn't want to like discourage young people from participating in sports and things like that, but it's kind of learning your limitations. So
yeah,
if you're going to have a day of, I don't know, like one of the teenage boys that I can think of off the top of my head plays basketball, but he knows that if he has a day where he's playing basketball, then the next day he might have to have a day where he's doing less activity, just to compensate. Otherwise that can trigger.
Definitely. So it's the same like with Sienna with PE. There's some things that are just a massive no-no. So running, any like sprinting, long distance running, I know that she can't participate in those because it will probably bring on a mild crisis or a serious one. Whereas, you know, rounders or, like you said, netball, where there's not too much, there is some activity, but there's not too much running where she's going to get breathless or it's like very, very physical. Yeah, she can definitely do. And one of the interviews actually for World Sickle Cell Awareness Day is with a fantastic, inspirational guy who's actually a personal trainer and has sickle cell. And he talks a bit about, you know, the things that he's learned that he can do and when he needs to rest. And it's kind of knowing your limits, but not allowing your condition to completely define everything that you do, but doing things that you're not going to trigger stuff.
Yeah, exactly.
But when it comes to a sickle cell crisis, so we work with a lot of families, and one question we get asked a lot is, when do you know if you should take your child to hospital? Like, are there should you go on the pain score? Should you go on how long they've been experiencing the pain for? When would you say parents of children that have sickle cell or adults with sickle cell, when should they go to the hospital?
I mean, I think it will vary amongst individuals, and like you said, you get to know your child. So the older they become, the more in tune you are, aren't you, with what they are like and how it affects them. So I think there's probably a lower threshold during early years for taking them to hospital because you've never really experienced it,
and they can't communicate either.
And they can't,
that's very difficult.
Thing. But I mean, particularly in a pre-verbal child, if you think they're in pain, then make sure they're hydrated. So the first thing we always say is make sure that the young person or the baby or whatever is drinking plenty of fluid. Encourage them to rest. Make sure they're kept, warm, not too hot, obviously, but kept warm. And the main pain relief that we would advise families to use are the over-the-counter pain relief. So paracetamol or Calpol, as the generic name, and ibuprofen. They're the medications that you can buy over the counter, and they're the medications that we would advise you to use. And just and administer as it is on the bottle. It will tell you how much you can give the age of your child.
And it's saying that obviously check the child's hydrated. Sorry.
Yeah, no, that's okay. So yeah, encourage the child to drink water essentially, but if any fluid is good, really. Make sure that they're resting, they're kept, they're warm, and use over-the-counter painkillers such as paracetamol and ibuprofen, and you can use them together. So if you think your child is in pain, you could give paracetamol and ibuprofen because they work in slightly different ways, and ibuprofen has an anti-inflammatory aspect to it as well. So it might be that the first lot that you give both, see if that takes effect, and then give regular Calpol. And if that's not taking the pain away, then give the regular ibuprofen as well after that. So if that's working, then that's good, and it might be that you can manage at home for a couple of days, say. But if you're giving regular paracetamol and ibuprofen and your child is still in pain, then definitely seek further advice at that point. And the other thing to bear in mind is if they have a temperature, so if they have a high temperature above 38, then that's another point where you should think, actually, I need to get them checked out, because if there's an infection going on as well, it may be that you need more than pain relief.
Yeah.
If you're maybe used to dealing with painful crises at home, you'll know, you know, if, oh, this might be a couple of days and then they'll get back to normal. So if it's going on for longer than that, or longer than what you've experienced previously, then that's another reason for getting further advice as well. And like I said before, particularly in the early years, because and pre-verbal, you might not have experienced it before, so there's no harm in getting them checked out.
Yeah, and we always say to like parents, if you're unsure, just go to the hospital.
Yeah.
Because they'll give you advice, the child can get checked over. There's no point putting anyone at risk by trying to deal with stuff at home if you're unsure what you're doing or what it is. Because I think the other thing that a lot of people forget is, okay, somebody's got sickle cell and they have pain, but they're still a human being, and it could always be something else as well.
Exactly.
Not everything, not everything that is pain related is always to do with sickle cell. So yeah, if people are unsure, we always say just seek, like you said, seek advice. Don't try and do stuff at home by yourself if you don't know or you're not used to it.
Yeah, definitely, because things can escalate, particularly in children, quite quickly. And you're right, you know, it may not be sickle pain. I mean, in an older child, if they've experienced a lot of crises, they may be very good at describing what the pain is like and know themselves the difference between sickle pain and whether it's something else. But in a younger child, it's hard to know. So I would always err on the side of caution and, you know, seek advice, whether it's your local ED. That's, you know, that's what the access is for some families. Other families have the luxury of being able to call their local children's ward, but it just depends what your local pathway is. And the other thing to bear in mind is there are standards for treatment of a sickle cell crisis. So if you go into hospital, you should be given pain relief within 30 minutes. So we always say to families, we give them a little A4 sheet.
Yeah, we've got one.
Yeah, you know, and it doesn't do any harm just to present that in A&E and say, look, my child has sickle cell disease. They need pain relief quickly, because not everybody will be aware of that standard or even have seen it.
So I tell everybody about this because it is such a good idea, because you'll be aware that not everybody understands sickle cell, including healthcare professionals. Sorry, so you can go to an A&E department and people won't understand the severity of it. So it's from Sienna's consultant. It's a little letter and it says, please administer some kind of, if it hasn't been given already, give pain relief within 30 minutes of arriving. And it's kind of got a checklist almost of what they can do to help. And for me, when we take that with us, it almost gives us some validation as to why we're there, and not just be seen as this frantic mum whose child's in pain and needs help straight away. Because it comes from an NHS consultant, I find like it is, worth its weight in gold. It's absolutely amazing. And I was saying to somebody yesterday, I feel like it should just be standard across the board that any patient with sickle cell should have one to when they go to present when they go to A&E.
And actually, these days you could probably take a photograph of it and have it on your phone.
Yeah, definitely.
You know, because
maybe you and I could speak about maybe arranging something, because I do feel like it really just makes life easier when we go to A&E, especially if the department's busy. Most of the time for us, we're lucky in the sense that the staff know Sienna, but there are circumstances when we get there and I've never seen anyone before, so they don't know. You know, Sienna, even if her pain is 10 out of 10, she won't cry, she won't be screaming, she'll be presenting well, as they say, which doesn't go down well with me. But it's just having this letter to show them and say, right, Sienna's specialist consultant says that you need to do this and this is how serious it is. It's just so helpful, and I'm really grateful that we do have that. So say thank you for us.
I think the thing is as well, in that situation, you're stressed anyway, and sometimes you may not always be able to explain things as well, perhaps. So just having that document, like you say, that's got a consultant's name and the, you know, an official document, I suppose.
Yeah, definitely. And I always say to people as well, as a bit of a tip that I've learned, especially when you're sleep deprived, is when Sienna, as soon as she says to me, like, Mum, my back's hurting or whatever, I write everything down, because there are times when we will have to rush to A&E at 3 o'clock in the morning. Sienna's in pain, she can't walk, I've just had to throw stuff in a bag, and then we get there and the triage nurses, what time did she have ibuprofen? What time did she have paracetamol? How long has the pain been starting for? When was the last time she went to the toilet? And all this other stuff. And I'm just like, it's 3 o'clock in the morning. I don't know the answers to any of these questions. And of course I do know, but at that time when you're asked. So I just say to people, whenever your child has pain or they're feeling unwell, just write some notes down on a piece of paper, because it's so much easier to just say, right, at 5:15 Sienna had paracetamol, at this time she had, and just be able to give that to somebody, rather than, you know, getting stressed or overwhelmed with not being able to remember at that time.
No, definitely, that's a really helpful tip, and also that helps the medical staff when you go to hospital, because they may need to give her something stronger. So because if they've had paracetamol or the ibuprofen within a few hours, they can't really give another dose of that at that point. But if they're still in pain, you know, something stronger needs to be used. Yeah, that is a good tip. Actually, going back to the level of pain, that is quite a common mistake, I think, that maybe health professionals do make, if they look at the person and think, well, they're just lying there, they're on their phone, they're not in pain. But I think for somebody that's had several crises over a period of a number of years, they get used to using distraction techniques and other things to be able to cope with it, so they don't always present like somebody that's never had a painful episode before.
Yeah, and I think you're right. Sienna uses music, art, watching stuff as her distraction. So although from somebody on the outside of our bubble just see a young lady watching TV, but she's saying that she's in excruciating pain, may mistake that as, well, she looks comfortable and cozy, you know, she sat watching TV. But I always say that don't devalue or discredit what they're saying, because most of the time Sienna's usually pretty spot on with her. And so in Reading they use 1 to 10 as a pain score, but I know in Oxford they use 1 to 3, which I think for younger children is a lot easier to manage when they're talking about their pain score. And again, like, families will get used to this and they'll find what works best for them. Because I felt like when Sienna was a lot younger, 1 to 10 was just too much for her. She just knew that she was in pain, and she knows what it's like when she isn't in pain, and it was too broad a scale for her to comprehend. So when she was younger, we used to probably use 1 to 5, which was a lot easier. But now that she's older, she knows exactly what 10 feels like and exactly what 1 feels like, so it's more manageable.
And there is a lot of children's wards will use a face as well. There's a face scale. They may use that with younger children that aren't able to use a numerical scale. So there are different ways of assessing.
Yeah, definitely. But yeah, Sienna has had a 10 out of 10 and she hasn't been screaming, crying and everything. So if you parents are in that situation where somebody is saying that their child does look well, you have every right to say that this is normal for them. Some people do, you know, pain is different for everybody, and there's no good or bad or right or wrong way to react to pain. So yeah, just make sure that people let healthcare professionals know that that is normal for their child to behave in that way. So we're coming towards the end of our interview, Lesley, and we are asking everybody, if you had a bucket list, what would be the first thing you would want to do on it?
Well, I love traveling to new places and meeting new people, and I've never really been to America. I've only been to New York. I haven't been to America. So what I'd quite like to do that Route 66 and travel. My husband likes cars and things, so I guess we'd have, I don't know, some groovy vehicle. But it'll be good to do that.
A Mustang.
Travel across a few states and just see a bit. So yeah.
We were going to do that a few years ago, and then I thought maybe it's not such a great idea with 2 children.
Yeah.
I think they'd be like, oh, when are we going to get out of the car? But it's always been on my bucket list, actually, Route 66. It looks incredible. And you can kind of dissect it, can't you? So you can do little sections or do the whole thing, or yeah.
Yeah, it'd be a cool thing to do, but we'll see.
Not one day. Yeah, nobody's going anywhere at the moment. But one day soon. Lesley, I just want to thank you so much for taking time today to speak to me. Like I said before, you are so valuable, and we appreciate all of your support and everything you do, because you cover the whole Thames Valley, so not just locally, and you help so many families, just being there for them and being so empathetic. I think that's one thing that most of the children will say is, you're so approachable, you're so kind, and it's so important to have somebody like you on this journey with us, because it just makes life so much easier. And yes, thank you so much for today. We really appreciate it.
My pleasure. I think navigating the NHS is difficult for anyone, isn't it? And if you have to do that for the whole of your life, you need somebody that can be there to help you.
You are awesome at it, so we are very grateful. So thank you everyone for watching today. We've got more coming up, and if you have any questions, feel free to ask, and we'll catch up with you soon. So I'm going to